Okay, I want to tell you about a situation that happened that's very near and dear to my heart. I remember it like it was yesterday. It was the summer of 2014, June of 2014. I don't remember the exact date. I think it was the 14th. I think it was June 14th, 2014. But what I do know is it was the Saturday that was the day before Father's Day. And the reason I know this date is because 10 years before that day, on the Saturday before Father's Day, that's the day my son was born. So 20 years ago, when my son was born, it was the Saturday, the day before Father's Day. 10 years after that, the Saturday, the day before Father's Day, I'm at the fire station. My partner that day, her name is Angela. What was kind of cool is Angela, this day we happened to be working together, but she was also one of my students. She was actually, I think, the top student that semester when I was teaching at the college. Well, so fast forward, now we're working together. That particular day, we're on a shift together. I picked up a shift on the ambulance. This is many years ago, so this is 2014. And a call comes out. We've been running all day. I'm now hungry. It's in the afternoon. We've had back-to-back calls, and I'm just trying to get a break. I'm actually just trying to eat really quickly. I'm about 3 charts in the hole. And for those of you who know me, you know that my charts were always very thorough, but it may take me a minute to finish them. I don't know how many times people have said, "Hey, Doc, you still writing your book?" My charts were very thorough, but sometimes there again, it took me a minute. Anyway, we're sitting at this fire station. A call comes out. I remember I'm out in the county that particular day. A call comes out. Tones go off. Need you to respond, emergency. And they say, give us the address and tell us patient unresponsive, prior complaint of chest pain. So we hurry up, get in the ambulance, roll to the house. I remember as we pulled down the street, the house was over so coming down the street, the house was to the left. So Angela was driving, I'm in the passenger seat. She pulls over, right next to the curb, puts the ambulance in park. Anyway, we come out with the stretcher, the jump bag, the cardiac monitor. We go up the driveway, go down the sidewalk, get to the front door, knock on the door. We met by the patient's wife. Have a little hard time getting in the door just because of all of our equipment. Anyway, we go inside, and I would find a gentleman there, 55-year-old guy. His name is Kevin. Kevin is sitting there. And you know how sometimes when you look at patients and you start asking them questions, and even before you ask them questions, you're looking at them. You're looking at their face, and some patients have that look, right? You've heard of patients either being sick or not sick. Well, across the room, or as soon as we could get into the room, I could look into his face, and I knew something was wrong. I knew something was serious. I didn't know what yet. I just knew by the look, this patient looks sick. You've ever had those patients that you ask them on a scale of 1 to 10, 10 being the worst, how bad's your pain? Some patients will tell you, 25, as they're texting on the way to the hospital or sitting in the emergency room and watching a comedy show. And they say 25, and you look at them like, 25, huh? Well, this particular day, I get to that part of the questions, things are having to move very quickly. I get to that part, and he says a 10, and I believe him. I can tell by his face that, this is probably, I don't know, there again, I don't know what the situation is yet because I just walked in the door. But I can tell that his breathing is becoming pretty labored. So I say, okay, sir, I don't want you to talk just right now. I start asking the wife questions. She's standing there, and I can look at her face, and I can tell that she's a little concerned.
My name is Kevin Boykin. I met Joshua on June the 14th in 2014, when at the age of 55, I was having a heart attack. He was a paramedic dispatched to my house. When he arrived, he hooked me up to an EKG, at which time he realized that the heart attack I was having was a little different than a normal heart attack. As he later explained it to me, he knew that he needed to prime the pump, so to speak, to make sure that my heart would get more blood flow. At the time, it had no blood flow on the right side. He knew not to administer nitroglycerin. He got me stabilized and off to the hospital, where I was rushed to the cath lab and had a stent put in my right coronary artery, at which time my heart stopped 3 times on the table, and later found out that had I not made it to the hospital in the time that I did, I wouldn't be here today. So fortunately for me, Joshua knew what to do, and he followed up with me many times and has kept in contact with me over the years, and I'm very grateful for that.
So, we come in the door. I say, "Hey, sir, my name is Joshua. This is Angela. We're the paramedics. How can we help you?" He starts telling us, and there again, he's having some trouble. So the wife starts kind of filling in the details. What the story was is he was outside. There again, it's a hot summer day down in the southern part of the U.S., southeast part of the U.S., and he had been putting together, I believe, one of those above ground swimming pools, laying laying the foundation and all that for the pool. It's very hot. He starts having chest pain, goes inside to kind of take a break. He's very dehydrated. The chest pain gets worse and worse. So I start immediately, I go into my mode of starting to ask questions. All right, are you allergic to anything? No. Have you taken any medicine? No. Have you had no aspirin? No. Do you have any ulcers? No. I'm starting to go through everything quickly. I say, Angela, give him 4 aspirin. So I go ahead and put him on a 4 liters per minute via nasal cannula. Let's go ahead and get him some oxygen. Say, sir, I don't want you to move. I'm going to do everything I can. You just stay as still as possible. See, the patients, they always get in the position of comfort before you get to them. They're not going to purposely put themselves in an uncomfortable situation. So whatever position you find them in, it's best, for instance, if you're going to do a 12 lead, do it in that position. So I say, okay, so sir, I get on my knees on the floor. I start hooking him up to the monitor. I hook the limb leads up, put the precordial leads up on him, and then I run the 12 lead. I say, sir, what I want you to do is I want you to be really still. Don't move, don't talk. Run the 12 lead. I said, okay, you can go ahead and breathe. And now I'm interpreting the 12 lead exactly how I've taught you to do it. Remember, I start with step 1, figuring out the rate, and then we go to step 2, 3, 4, 5, 6 of the 6-step process. Immediately, as I am going through it, I get to, for instance, step 4 is I look for axis. Step 5 is I look for hypertrophy. Step 6 is I look for evidence of infarction. I'm going to this really quickly. There's some things that jump out at me. I see some ST segment changes, for instance, in leads 2, 3, AVF. I see some reciprocal changes. Obviously, that's our next topic we're going into. So I'm going to explain all of this. Immediately, what I do is I take V4 from that position and move it over to the other side of the chest. I just move that one wire, get another electrode, run the 12 lead again, but this time V4 is on the right side of the chest, so it's going to be, of course, called V4R. I run that one, and I say, so I look at it, I interpret it, I recognize that he's having some right-sided involvement. He for sure is having a right-sided heart attack. I know it's serious, so I say, okay, Angela, we got to go. So I look at him, and as calmly as I can, I say, Kevin, you are in fact having a heart attack. The good thing, as if there is a good thing, but I say, the good thing is I know exactly what to do for you. Here's the thing, I don't want you to move much. We're going to do everything for you. We get a set of vitals. I realize that his blood pressure is okay to support nitro, but based on his condition, I make the decision that we're not going to give nitro. Just because he's already preload dependent. I don't want to bottom him out. I don't want to kill him. So I say, sir, what we're going to do is we need to go ahead and move quickly. We go ahead and get him loaded up, get him in the back of the ambulance. I say, Angela, she was a little bit aggressive on the driving. So I said, Angela, I need to get there quickly. We need the cath lab now, but get me there smoothly. So Angela gets in the front seat. First she slams the doors of the back for me. She goes around and gets in the front seat and woo, woo, whew, here we go to the hospital. Right before the wheels started moving, though, went ahead and put the multifunction electrode pads on him just because there's a good chance that his heartbeat may stop. I'll tell you why here in a moment. There's a chance that his heart may stop. So I go ahead and put the pads on him. I also go ahead and elect to get one IV before the wheels start moving, simply because if he codes on me in the next few minutes, if I already have the IV in, it's going to be a lot faster for me to go ahead and start pushing meds. So I said, okay, I'm going to get one right now, and then give me 1 minute. I'll get one right now. And then en route to the hospital, I'll go ahead and get a second line. I go ahead and start some fluids for him. And then I get on my knees in the back of the ambulance. I remember his left shoulder is close to me. I put my hand on his left shoulder and said, Kevin, I'm going to do everything possible for you. Anyway, I finished more treatment. I go ahead and transmit the 12 lead to the hospital. I'm requesting cath lab on arrival. This is serious. We need a cath lab right now. I'm 20 something minutes away from the hospital. So, we've time is not on our side. Anyway, I decide to go ahead and transmit the 12 lead. I call in the radio report, tell them that we do have a STEMI. I want a STEMI alert, cath lab on arrival. Now, sometimes, depending on who the provider was, I even worked in the emergency room myself, and sometimes with certain paramedics or nurses, the physician would just say, hey, bring him in and I'll evaluate him when you get here. Well, the charge nurse would later tell me, she said, I heard your voice, and when you said it was a STEMI, I knew it was a STEMI. We get him to the cath lab, they transfer him over. Long story short is Kevin's heart stops 3 times on the cath table. He ends up getting a stent placed. I go back to see him. That's a Saturday. I remember going back to see him Sunday after church. He's actually sitting up. And we talked. I remember sitting on the side of the bed and just telling him about what happened. And I asked him, I said, well, Kevin, how did you feel physically going through this? He said, it was like the worst pain I've ever had. I said, what was your experience like in terms of how did we take care of you? He said, you just looked like you knew what you were doing. I said, well, I'm grateful to hear that, because I remember there was a day where that wasn't the case. But of course, I had studied this for years. I had even been teaching this for years at this point. And so I was very confident. I knew what was going on. I knew how to handle it. I don't take all the credit. It actually started with his wife recognizing the symptoms, calling 911 right away. That call taker who took that call, getting the information properly, relaying it to the dispatcher who communicated it well with us. And then Angela and I showed up, and of course, the rest of the healthcare team did their part. So everybody played a role in that. I remember when I saw him, though, that the next day on Sunday, and then the following day on Monday is when Kevin got discharged. He's actually doing well. We still stay in touch today. But I remember, so that happened in June, right? It's the day before Father's Day. Fast forward. It was, wow. It was February 4th, 2015. And the reason that day is so special to me, it was Kevin's birthday, but it's my birthday. I got a text message on that February 4th. I remember getting up that morning, and I got a text message from Kevin that said, Joshua, good morning. I just want to let you know that because of what you did that day, I get to see another birthday. Wow. Guys, and there again, I don't take all the credit, but that's why I'm so passionate about this. The reason I want you to know this is I want your patients to have the same kind of outcome that Kevin had. I'm grateful that it worked well, but I think back to, what if I hadn't put forth the effort to learn this? What if I didn't really go overboard and really trying to master this topic? Obviously, I've gone on and helped hundreds of patients since then with similar situations, but I'm just so grateful for the outcome. So guys, I just ask you, make sure you go all out for your patients. What you're learning today, what you're learning with us through this EKG Mastery Challenge, it's not just for you to know information. There's a patient whose life is depending on this, okay? So, whoa. So guys, I apologize. I didn't mean to I didn't mean to get so emotional about this, but I want to tell you exactly what happened in his situation.